Welcome everyone to All Aboard the Omnibus, Benefits-Related Provisions in the 2023 Federal Spending Bill. Thank you all so much for joining us. Our moderator for today's call is Chase Cannon. He will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'd like to introduce our speakers for today's webinar. Joining us today are Beth Allen, Vice President and Counsel of Benefits Compliance at NFP, and Roger Abrahamson, Vice President and Counsel of Benefits Compliance at NFP. We're very excited to have them speaking with us today. It is my pleasure to hand a call to our speaker. Beth, the floor is yours.
Thank you so much, Amber. Happy New Year to everyone. Welcome to the first Get Wise Wednesdays of 2023. We got a new year and a new spending bill to discuss. And so welcome to today's presentation. So introductions as they go, you all I think are pretty familiar with me. I'm Beth Allen, and making his GWW debut is Roger Abramson, who is the newest member of the Benefits Compliance team. So we get him out there early to come out and present to you guys. So welcome, Roger, and you all will hear from him shortly. As always, although we are lawyers, we are not your lawyer, and we're also not providing tax advice. So keep in mind that the presentation today is going to provide general educational guidance and that the information is current as of right now, this moment. Things change quickly in this business, as you all know, but for right now, we can vouch for the fact that things are correct in this slides. All right, so today's agenda really is to talk about mostly the federal spending bill that we got at the end of 2022, which is the Consolidated Appropriations Act of 2023. We'll talk about that generally. We'll talk about the health and welfare provisions of it to keep in mind, which were really just the telehealth relief extension and some APIA changes. We'll talk about the Secure 2.0 Act, which was probably the biggest chunk of it having to do with employee benefits, but affects retirement plans. Okay, so I know that many of you are used to joining these calls to hear us talk about health and welfare benefits, but we're going to spend a decent amount of time talking about retirement benefits. And even if you do not actually have responsibility for retirement plans through your job, if you are enrolled in one, then it's important information for you. And even if you are not enrolled in one, then when you do become enrolled in one, there's some pretty good information for you as well. Ending out the year, but not quite a part of the federal spending bill, was RxDC relief. And so for those of you who were furiously trying to meet the requirements for the RxDC reporting by December 27th, the government came out, like, I don't know, days before that and said, hey, we'll give you an extension, and we'll talk about that briefly. And then we'll just do kind of a brief conversation looking ahead and discuss some compliance takeaways. So going into the Consolidated Appropriations Act of 2023, this was the annual budget, basically, that the federal government signed. You see a picture of President Biden signing that on December 29th, 2022. Keep in mind that the federal government's fiscal year actually starts in October. And so in October of 2022 is when the 2023 fiscal year started for the government. But as we have all seen over the last several years, we don't have enough agreement usually to have a good budget by October for everything. And so we have what is called the Omnibus that'll generally has come out by the end of the year to basically avoid a government shutdown. So that's what we got here. Really big bill. It was a $1.7 trillion with $772.5 billion in non-defense spending. And that chunk of money is what encompassed the changes that we're going to see or discuss today. Okay, so we got a few benefits related provisions really on the health and welfare side, but the biggest kind of piece that affected employee benefits was Secure Act 2.0 or Secure 2.0 Act. Okay, and so there's a link to the bill if you want to go and read thousands of pages. You know, you need help sleeping at night, that would be great. But we're going to discuss telehealth relief extension, MAPIA or mental health parity changes in the bill, and like I said, Secure Act 2.0. Now, mind you, there were some changes to Medicaid and Medicare. And as many of you know who have been kind of involved with health health and welfare plans. As some changes are instituted to Medicaid and or Medicare, we often see private health plans follow suit. And so you will potentially see some changes that come out of that. But we really wanted to just focus on the provisions that are going to affect employers with employee plans right now. So with that, I'm going to introduce Roger to talk about our telehealth relief extension.
Thank you, Beth, and thank you, Amber, for the introduction as well. Hello to everyone. Good afternoon, I think, to pretty much everybody. Nice to meet with you virtually today. So we're going to kick this off a little bit with a portion of the act that people have been following throughout the year last year, and that, of course, is the extension of the telehealth relief for HDHPs or high deductible health plans. As we all kind of know, generally speaking, to have an HSA, to be HSA eligible, to establish one and make contributions for one, you have to be covered by a HDHP. And the main point of an HDHP is that very little, other than, say, preventive services and a few other things, are paid for what I call beneath the deductible, for lack of a better phrase. You have a high deductible plan, and you pay for that out of pocket, consumer-directed healthcare, and in return for that, you can have your HSA. Well, we can hop back in our Doc Brown's DeLorean, I guess, back in time, almost 3 years now at this point, if you can believe it, in March of 2020, and as part of the huge CARES Act that was passed in response to the pandemic that had just begun, the Congress put a provision in the CARES Act allowing for plans to cover telehealth medical services, calling into your doctor, doing it online, and so forth, on beneath the deductible without disqualifying that coverage for being an HDHP. The rationale behind it, obviously, was we had a budding pandemic. Let's keep people out of doctors' offices and hospitals and so forth when they're not needed, and let's do telehealth coverage, and in return, your HDHP coverage will not be disqualified as HDHP coverage. One point about it that people were confused about at the beginning, and some folks were, but it was clarified, is this had to do with any services. It wasn't just, okay, we'll allow for it if it has to do with a COVID diagnosis or treatment, anything, any medical services at all were applicable for this exclusion. The way it was written was, it was originally limited to plan years, quote unquote, in that legislation beginning on or before 12/31/2021. And then later it was extended to months as opposed to plan years, beginning after March 1st, 2022, and before January 1st, 2023. And actually, that was part of the Consolidated Appropriations Act for 2022 back in 2021. So you might notice there a little gap, and that gap is there because the Consolidated Appropriations Act of 2022, passed in March 2021, was put together in March. And so they put that language in there. We'll extend it for months beginning after March 1st and before January 1st, 2023, or this month. And we'll talk about that in the next slide. So we're trucking along last year through calendar year 2022, and this has been part of this bill that sort of was put together, this giant omnibus package back in spring of last year, and then it kind of moved along slowly and so forth. So were they going to extend it? It was put as part of the bill, and if it passed, then yes, it would. And so finally, of course, here we are, and it extended the exception to planned years. We're back to that phrase, as opposed to months, beginning after December 21st, 2022, so essentially anytime in 2023, and before January 1st, 2025. So roughly speaking, without going into too much detail, through 2024, and then plan years ending after that, that they began in 2024. So that all sounds great and nice. People are excited about the extension and so forth. But there remains this little issue for non-calendar year plans. So these are plan years that are off calendar year, so forth, not running January to December, but any other time during the first part of 2023, just like the gap before. Essentially, if you were off your plan year, say you started in July 1st of last year for this plan year, then that plan, I should say, if it offers telehealth services beneath the deductible, these months right here don't necessarily count for that. In fact, they don't, the way it is written. And not only is there no relief for that, there was no retroactive relief provided for that same gap that was caused for a similar reason from January through March of 2022. So the good news, though, is that the HSA legislation, or the law itself, allows for what's called the last month contribution. So if at the end of in December, you are an HSA eligible individual, that is, you have an HDHP, then you can put a full year's contribution in, so long as you're also an HDHP HSA eligible individual for the next 13 months. Excuse me, for the next 12 months. So for that whole 13-month period, you have to be an HSA eligible individual. That's really the only quote unquote remedy that's there. It's one thing to remember, though, that this exception that's there is not mandatory. HDHPs are not required to cover telehealth services beneath the deductible. They're just allowed to for these time periods, and they will not be disqualified as HDHP coverage. So real quick, it's often asked, will this, how long would this be extended? Will this be extended forever? Will they keep it? But we don't know, of course. The problem is this sort of gets added in the middle of certain circumstances, then it kind of floats along for a while. And then once everybody sort of agrees on the package, it gets passed. This was put on back in March of last year, and here we are. So the arguments for it continuing beyond the where it stands now in 2024 is telehealth's pretty trendy. People like it. COVID still kind of lingers. Arguments against it, though, generally speaking, this is rather inconsistent with the original rationale for HSAs. This isn't really about services that are being provided. It's about how the services are provided. So does it really make a huge difference if you're going to see the doctor or if you're seeing the doctor online outside of the pandemic context? And people are a little tired of COVID unless it flares up again. So it's hard to say what's really going to happen. What will probably determine it ultimately is really how popular this is. At the end of the day, it's a political thing, whether this continues beyond the current extension, and we're just going to have to kind of sit back and wait and find out. Moving on to the other health and welfare aspect of excuse me, the Consolidated Appropriations Act, and that is MAPIA, which is the Mental Health Parity Act. And the big news in that regard is that self-funded non-federal governmental health plans can no longer opt out from these mental health parity provisions. The Mental Health Parity and Addiction Equity Act, MAPIA as we call it, essentially, not to go too deep in the weeds on it, but essentially if plans offer mental health coverage, they have to be done on the same basis as other health issues, physical and so forth, are those benefits are offered. And that's basically the very rough overview of what that does. Still, self-funded state and local governmental health plans have long been able to opt out of it. They could opt in, say, yeah, we're going to comply with that, but they haven't had to, and many don't. That option is no longer available to them. This provision is effective immediately. Now, if there are some active opt-out elections in act or in force right now, which of course there would be many, then those that expire 180 days after the passage of this act, when it was enacted, and that would be roughly June 28th of this year, they can no longer be renewed. And this is an example, the mental health parity, as well as what we talk about on the next slide, of the continued policy expansion of an understanding of the need and demand for mental health coverage. The other thing that Consolidated Appropriations Act did is it also provides some funding to help states enforce, and now we're going back into another Consolidated Appropriations Act from 2 years ago, the 2021, what's called the comparative analysis requirement. And that's essentially requiring plans and insurers to kind of do internal reporting and analysis of how they apply certain standards for coverage for mental health coverage, compare that to what they do for all other forms of health coverage. So for instance, nothing that uses numbers, essentially. It's like, how do we make pre-authorization decisions? Do we have a tendency to, or does the plan have a tendency to say, okay, well, let's try this lower cost possibility before we do a higher cost? Do they do that on a more of a different basis they would with other kinds of, for instance, physical health coverage and access to out-of-network providers and so forth? So again, the purpose of this is to determine whether these sort of standards are applied to mental health and substance use disorder benefits in a manner comparable to medical and surgical benefits. So again, this is an ongoing policy with regard to the expansion of mental health, and it was probably only a matter of time before finally these self-funded non-governmental or non-federal, governmental plans, the state and local plans, would be brought into the fold here. And with that, I'm going to turn it over to Beth, I believe is next, to talk about Secure Act and the many provisions in that regard.
Thank you, Roger. And, I love, those of you who have been watching these for a while know that I love mental health parity. Part of what I did when I was at the Department of Labor is kind of get started on the earliest iterations of enforcement of MAPIA. And so it's a conversation that I love. But as many of you know, the government has been very focused on it, and there has been very bipartisan support for this, right? And so I definitely think that change as far as the non-federal governmental entities is going to be one of the first changes that I think we're going to see in a line of changes having to do with mental health parity. I know that the Biden administration actually wanted to make it to where mental health was required to be covered through plans. Remember that with mental health parity, it doesn't actually require you to cover mental health. It just says that if you do, you have to offer it in parity with medical surgical coverage, right? But because we see kind of this confluence with states also having an interest in mental health parity and just mental health treatment, and society at large also understanding the need for mental health care, I definitely think we're going to continue to see the federal government move on this, okay? I will also say that we have already gotten a lot of kind of notes here and there of states who are looking to enforce this requirement already, who want to see that comparative analysis from the insurers that are registered in their states. We have seen some states want to see actual, instead of non-quantitative treatment limitations, going back to actually quantitative treatment limitations and financial requirements, and wanting to see the information on those as well. So I think this is going to be a continued conversation that you really just want to be mindful of and make sure that you're getting your ducks in a row. But thank you, Roger. As Roger mentioned, we're going to move on to the Secure Act, which is what we're going to spend the bulk of the rest of today's conversation talking about, okay? As Roger mentioned, we have been getting these Consolidated Appropriations Acts now for a while, and we actually got the Secure Act. I kind of call it 1.0, although technically it's just the Secure Act, but Secure Act 1.0 came out in 2020 as part of the Consolidated Appropriations Act of 2020. It came out at the end of December 2019, okay? And so interestingly, there was super bipartisan support for the Secure Act when it came out. And immediately after it came out, there was bipartisan support to updating it again and adding in more things, okay? And so that's what brought us here. I think over the course of the pandemic, we did see some bipartisan bills that were brought, let's say, to the House floor. The House actually voted on a bill. And we saw a couple of different bills come out of different Senate committees that also set this up as a follow-up to Secure Act 1.0. And it came out as Secure 2.0 Act in the CAA 2023. Now, I will say I am in favor of that acronym because some of the other acronyms were a little ridiculous. One of them was the Rise and Shine Act, which has to be the longest acronym I've ever seen for a government bill. But keep in mind, we just ended up with Secure 2.0, okay? And obviously it builds upon and enhances the Secure Act that we got the first time around. Interestingly, the bill is broken into 7 titles. It's a whole lot of pages, hundreds and hundreds of pages, but it's broken into 7 titles that really go towards the purpose of what what they are looking to accomplish with all these different provisions, okay? Keep in mind that I'm going to talk about a number of them today, right? Time would only allow for me to talk about a handful of them, but because there were over 90 provisions, we're going to really kind of talk about, I kind of broke them into 10, if you will, with some of the 10 kind of including a number of the different provisions. But we're only going to talk about kind of 10 concepts, and all of them pretty much live in these titles, let's say 1 through 4. Maybe there's 1 and 5, but keep in mind, tons of provisions there. And they're kind of all, it seems like a hodgepodge, but there are themes around those 7 titles that you just saw, okay? So with this particular chart, I tried to kind of go through and just talk about each of the different requirements and put a lot of the major ones here. The ones that you see in bold are ones that I'm going to talk about in some way or another today. The ones that you see that are bolded or that are in red, if you will, are ones where it actually changed something that we got from Secure Act 1.0. And so that's kind of what that red means. It means that we had something like this the last time and it's already been changed. And so keep in mind that that's how I'm going to be talking about those provisions. With each of the provisions that I go through today, I want to say kind of what the provision is, what it means for employers, and an effective date of the provision. As I mentioned, many of you might not have retirement plan obligations on your job, but the vast majority of us, if not all of us, are probably in a retirement plan, okay? So each of these are going to be important for different reasons, but I definitely want to highlight what it's going to mean for employers on certain provisions. All right, so we're going to start off with one that might affect less of you who are on this call. So the first requirement is that new 401k plans and 403b plans have to basically auto-enroll their employees at 3% of a deferral with auto escalation at 1% annually up to 10%, I believe. Now, interestingly, this comes because of the idea that we know that people who are auto-enrolled in plans are actually less likely to leave the plan or to terminate their participation. And so that would potentially provide for more people to participate in a retirement plan and have one where they did not have one before, simply because of the fact that they're less likely to get out of the plan than they are to actively work on enrolling in the plan, right? So it's kind of this idea of passive enrollment that actually results in more people having a retirement plan. Now, we do see some plans that are exempt from this requirement, right? So simple plans, which are usually for those small employers who put in place a simple plan, already existing plans. So this is really just going to apply to new plans that employers put in place that they'll have to do that. So if you already have a plan, you do not have to auto-enroll employees, although you may want to do so, again, because that makes them more likely to have a retirement plan if they're not going to actively terminate their participation. Governmental and church plans are also exempt. Plans of businesses that have been in existence for less than 3 years, so really new businesses, as well as very, very small businesses, so that businesses with less than 10 or less employees are also not going to have to comply with this, okay? And this is going to be effective for plan years after December 31st, 2024. A note on those effective dates: all of these different provisions that we're going to talk about have different effective dates, some of them starting as early as the day that President Biden started or signed the bill, and others going out several years. I think the longest amount of years might be in 2033. And so I'm going to try to provide you an effective date based on that particular provision. So here's just one provision that, again, is geared towards the idea that we need more and more participants to have access to a retirement plan and to be enrolled in it. Kind of along those same lines of plans and access to plans. And this is with 403b plans specifically, which I kind of, try to pick provisions that apply to everyone equally. But obviously 403b plans are a very specific type of plans that are going to be offered to governmental organizations, and as well as some nonprofit or universities, things like that. 403b plans basically can now participate in multiple employer plans or pooled employer plans. And I put this in red because we actually got, let's say, pooled employer plans, or the idea of an open multiple employer plan, from the Secure Act, right? But Secure Act 1.0 did not actually take that step further and allow for 403B plans to participate in those pooled employer plans. And so now we have Secure 2.0 going through and changing that. And beginning as of the end of basically last year or January 1 of this year, 403B plans can participate in those pooled employer plans. That would allow for small employers who offer 403B plans to potentially be able to come together with other employers to have a retirement plan. Another thing that we saw about 403B plans is that it does allow or signal the idea that 403B plans can invest in collective investment trusts, okay? And collective investment trusts are really just an investment vehicle that allows for kind of pooled investments and things like that. Interestingly, we didn't quite get an effective date on this because there will be some additional legislation that's going to be required having to do with banking and securities that we definitely don't have yet. And I assume that we will get that in short order because the industry at large has wanted 403B plans to be able to access collective investment trusts for a very long time. They've been around for decades, and so it kind of didn't make much sense that they were basically applicable to everyone except for 403B plans, okay? So really these type of changes just make it to where 403B plan sponsors have more opportunities to access different types of retirement plan solutions and can start to take advantage of some of the pooled investment vehicles that we've had for a long time. So another change that you'll see kind of this red text, right? So that means we had one version of the Secure Act 1.0, and now we kind of got to change it to Secure Act 2.0, is that Secure Act 2.0 actually requires that employees with 2 consecutive years of at least 500 hours of service be eligible for the plan, okay? And it extends this rule to 403B plans. And so with Secure Act 1.0, instead of it being 2 consecutive years of at least 500 hours of service, it was 3 consecutive years of at least 500 hours of service. And so we pretty much immediately knew that they wanted to decrease that number of years. And again, this just allows for people who may not be full-time employees, but who may work for an employer for a number of years to be eligible to participate in the plan, even though they are not full-time. Okay. Interestingly, I think for employers, this is just kind of more tracking on top of, tracking that they're already doing, right? Especially if they're employers that are subject to the employer mandate, where they're tracking to see if some people make that 30 hours per week. They might be tracking based on the look back measurement method. But this is just another way that you're going to be tracking also for the retirement plan. And instead of the magic number being, 1,000 hours of service and a year, you're also going to have to pay attention to those who work for 2 years and have 500 hours of service. And so just another thing where payroll is going to have to get involved with counting the hours that people work. And so they're going to have to offer that coverage to part-time workers so that those types of people who work for a long time, but on a part-time basis, also have access to a retirement plan. And that's going to be effective for plan years after December 31st, 2024. Okay. And I saw just the need for clarification. It's 500 hours, not each year, right? Remember that retirement is different than health and welfare, and that once you meet that threshold of however many hours it takes, you are in the plan, right? So you don't end up being let out of the plan. Like at that point, it is your retirement plan. Now, there are different rules as far as the employer match or employer contributions that may not apply if you do not hold that many hours for a long time. There are differences for testing, right? So one of the things about this particular requirement is that the Secure Act said that you don't actually have to include those part-time people in discrimination testing. And so there are some distinctions there, but once you are eligible for that retirement plan, you're in it. Okay, so it's not accounting every year. It's once you get to that 2 years, that 2 consecutive years of 500, you are eligible for the plan. That was a good question, though. Now, moving on to something that I think is different and somewhat interesting, because we got some movement from the IRS on this, but not enough to kind of accomplish what was needed, I think, by the industry. One of the things that we got from Secure Act 2.0 was the idea that matching contributions can be made for student loan repayments. And so this would allow an employer to have a design where they say, okay, we are going to match the amount and put it in your retirement plan of student loan repayments that you make. And the reason why this is in place is because there's some thought out there that there are some people who have such crippling student loan debt that they are not able to actually contribute to their 401k plan. And so the idea is that if they, could allow for matching, so the employer could match those student loan repayments, then it would allow for those type of people to still have retirement accounts. I think that's kind of interesting, because I don't know if the studies are there to show whether or not people with a lot of college debt do or do not participate in their retirement plans. But I do think that is kind of an overwhelming or prevailing thought. And so this type of allowance would allow for employers to kind of make some retirement contributions for people who are paying off their student loans, and so they can basically defer on their own. This will be effective for plan years after December 31st, 2023. The other reason I said this was a little bit different is because of the fact that before this particular change in the law, what we saw was the IRS kind of come out and tease that they would allow this, right? And so they came out with a private letter ruling for a specific company that allowed for the company to do this design. I want to say they also have introduced a proposed rule to allow for this. And so the Secure Act 2.0 coming out and allowing this just outright does kind of move that up and make it available to all employers. All right, another change here in something that we got from the Secure Act 1.0 is an increase in the required minimum distribution age. Remember that by a certain age, you have to start taking distributions from your 401k or a qualified retirement plan. The reason for that is really just taxes, right? If you keep it in your retirement plan for years and years and years, and the IRS doesn't get the tax money that they get from you taking a distribution, and eventually they're going to want that to start because of budgetary reasons. And for the longest, that age by which you had to start making these required distributions was based on the age of 70 and a half, right? So 70.5 years. Basically, they had to start by like the April following you turning 70 and a half. Secure Act 1.0 changed that to 72. Right. And then almost immediately, everybody was like, no, that's still not old enough. So basically, we see the Secure Act 2.0 coming in and doing a phased approach, changing that age of requirement of minimum distributions to 73 starting already now, so January 1st, 2023. And then that will also move again to 75 starting in January 1 of 2033. So 10 years from now, the RMD age will move to 75, okay? So obviously this allows for participants to go longer without being forced to draw on their retirement. It follows the idea that people are living longer, and so it makes more sense. Living longer and retirement is costing more, obviously. And so this is something that I think everyone pushed for, and seeing this age go up again is something that we all expected to be in this bill. Emergency savings accounts. This is a newer aspect of the Secure Act that we have that came out this year. And really, it kind of gets to the idea that I don't know what the numbers are, and I'm sure we could all Google them, but studies basically show that there's a large percentage of Americans who, if they had, let's say, $1,000 emergency, would not be able to front that $1,000 or would have a hard time, with their bills and such after having to pay just a $1,000 emergency, right? So that's, maybe a car, having a car issue, that's something happening at your home, but just a very low threshold of what people would actually start to struggle with. And so as part of that, one of the provisions of Secure 2.0 allows for employers to offer emergency savings accounts that are attached to the retirement plan. Now, these are only applicable or allowable for non-highly compensated employees, right? And so those who are highly compensated based on the IRS definitions, usually, which is going to be based on job title as well as based on a certain amount of salary, they're not going to be able to participate. But anyone that's not an HCE would be able to participate. And this particular type of plan can also include auto enrollment up to 3% or a $2,500 cap. And so this allows for the employer to encourage employees to basically save for a rainy day, and to have that money available for emergencies that they can take out without a tax penalty attached to that. Okay. I see the question, would the emergency savings account contributions be pre-tax? And yes, so they would be pre-tax, and that's kind of how that the IRS is allowing kind of for a specific amount with a specific cap, of how much they can use for that. I have to go back into it and see, because I can't remember off the top of my head whether or not it's just not penalized or whether or not they would still have to take, let's say, the taxes on that, but I'd have to see the specific rules on that. So that's a good question for me to follow up on. But really, this is just one of those things where if employers want to allow that, then they would be able to do it. I also see the question, do employees get to keep this amount when they quit their jobs? And yeah, I mean, it's their deferral, right? So they're deferring it. I assume that if their employer matched to any employer amount added to this, then there would probably be vesting rules on that. But again, all of these, and I should have said these on the front end, all of this is just kind of what we have now from the Secure Act. There's going to have to be regulations for a lot of these things to find out what the specific rules are on them. Okay. And so all we know now is that the law is going to allow it. We don't quite know the ins and outs of all the rules just yet. Okay. And yes, obviously, anytime you have, let's say, an auto enrollment of anything, there's always the opportunity to opt out. Okay. So the government actually does not allow for your employer to basically enroll you into something that you cannot get out of. There's always the opportunity for employees to opt out. So lots of questions on that one. So thank you kind of for your participation. And I know I answered a couple of those live. Hopefully the team can follow and respond to those by typed answers as well. And this one is going to be effective for plan years after December 31st, 2023. So we'll see that coming after the end of this year. And to kind of follow up that same concept, which is this idea that, people just need extra funds to deal with things that happen and things that life throws their way. We also saw a number of non-penalized withdrawals or distributions that Secure Act 2.0 brought up, that some of them are new, some of them not as new, but pretty much kind of, I think, all fit under this idea that there could be certain things that happen to a participant that would allow for them to draw on their retirement plan without the penalties that would normally apply. Okay. And so we also see, in addition to the idea of emergency savings accounts, there's also the allowance for an emergency withdrawal of up to $1,000 that is also going to be allowed after the end of this year. And so that's, again, when an employee has an emergency and needs to access those funds. Qualified birth or adoption distributions is actually something we got from Secure Act 1.0, but the change here is that now kind of there's a limit to how long a person could repay that if they wanted to repay it. And so Secure Act 2.0 brought in that change. That's why it's in red, is because it basically came in and said you'd have 3 years to repay that if you want to repay that back to your retirement account and not be taxed on the withdrawal. Mind you, again, these are just non-penalized, so there's not a penalty to the withdrawal, but there could still be taxation on the withdrawal just based on kind of the ideas that it's part of your gross income, if that makes sense. We also saw kind of new entries for domestic abuse and terminal illness, where, if you are dealing with a situation of domestic abuse, you can take a withdrawal, which I think makes good sense. Some people who have to leave a domestic abuse situation may need to draw on the retirement to be able to actively leave. And so I think that that's something that everyone was empathetic about. Likewise, terminal illness and having to deal with the, boon and health costs and what could be happening with, end of life care was something that, pretty much everyone can agree might be a good reason for people to be able to draw on their retirement. And then finally, we also saw kind of just really making permanent this idea that when there are federally declared disasters, you could take a withdrawal from your 401k or your qualified retirement plan. This has been allowed in some way for the last few years, but really it was based on IRS regulation and just coming out and saying, okay, when there's a federally declared disaster, you can take a distribution. That's what we've seen in the last couple of years. Before that, every single federally declared disaster, the president or someone would have to say, yes, this is a federally declared disaster, and yes, you can take a withdrawal from your retirement plan. And so this way, it's more permanent, and you do not actually have to have have each federally declared disaster, have them come out and say, yes, you can take a retirement distribution for that. It's just understood that if the disaster is federally declared, that you could take a distribution for that. Keep in mind that federally declared disasters can be disasters that will affect only people in a certain state or people in a certain area of a certain state. But just know that if it's actually federally declared, generally also it's going to come with the idea that FEMA is involved and things like that, then it is an opportunity for those participants in the affected area to take a distribution. Basically, this just provides more opportunities for employees to draw on their retirement savings. And so this is one of those things. Now, I do see a question in here about whether or not they have to pay it back. They don't have to pay back the amounts they pulled out. A number of these do allow for you to pay them back if you would like, but you are not required, right? You still are going to not have to pay the penalty that you would normally have to pay for withdrawal. But again, some of these, we're going to get rules on these that are going to give you the parameters of those requirements. All right, one that I think is interesting, 529 plan rollovers to a Roth. For those of you who have a 529 plan, then you know that that is basically a plan that you set up for qualified relatives that will provide payment for their education. And generally with the 529, there are some tax savings involved on both the federal and the state level. But the idea is that you can only distribute those to pay for educational costs, right? If you end up not taking the distribution to pay for educational costs, then you're penalized. And that can become a problem if you end up with a child who, let's say, gets the entirety of their tuition and fees and all that paid for, right? Then you might have this certain amount of money that cannot be used up. And if you don't have some other relative that would be qualified that it's also going to go to school or some trade school, then you might have funds that are just sitting in your 529 that you're going to take a penalty on when you take it out for some reason other than education. So this particular provision allows for you to take those funds, and instead of basically, taking the tax hit on it, you can roll it over to a Roth IRA over the lifetime of the beneficiaries. And so that's really interesting because it allows you to kind of take those from one savings mechanism and put them in another savings mechanism that is not limited to only education expenses. Now, there are obviously limits on that, right? So it can only be up to $35,000. The actual distributions themselves have to follow the annual Roth IRA limits, which are not that high. I think it's like, somebody would have to check me, but I think it's like $7,000 or something that you could do with a Roth IRA. But the point is, this is not going to be something that's unlimited because obviously taxes, but it does allow for some, participants who, like I said, might not end up with the need for educational funds like they thought they would have and would like to still have those monies be tax-free or not penalized, okay? And so this is going to apply to plan years beginning after December 31st, 2023. And I definitely think that this is going to be an option for some people. All right, this one is actually one that holds a special place in my heart somewhat. And really it's this idea of the DOL providing a lost and found database where participants can locate their retirement plan accounts. One of the things that I think a lot of employers on the call can be sympathetic to is the idea that when employees leave, so many of them will leave and not actually distribute out their 401k or account, right? And if their account is larger than the amount that the plan would force a distribution, then basically those funds are just sitting in the plan and potentially dwindling away from fees. And that person is out there in the wind, right? And in order for an employer to be able to, let's say, get those funds out, they have to track down that person. And it can be a nightmare really to have to do this for hundreds of employees over years and years. The reason I said this was close to my heart is because when I was a DOL investigator, and the reason that the DOL is actually also vested in this is because of the fact that if someone opened a case on a plan and there were these lost participants who did not have access to their accounts or had left and had not been distributed out, then a DOL investigator could not at the time close their case without locating all of those people. That was obviously a nightmare for certain situations and made it very difficult. And so this is a way for the DOL to create a database where people can kind of find account plans that they might have had in previous jobs. I think, again, this comes alongside kind of an option that the PBGC is allowing for defined contribution plans to basically hand over their accounts to the PBGC for people to come and find. And so I think this is really just another thing in a long pattern of the DOL recognizing that people leaving their employment will need to come back and access those funds. And it's best if, let's say, the government keeps a list of some sort where they can find that, okay? The requirement here was for the DOL to create this database by 2 years after date of enactment or being signed by the president. And so the understanding there is that they would create this by December 29th, 2024. Now, I think this is gonna be a beast of an online database. So I think that's gonna be very interesting to see how that happens. And keep in mind that employers are gonna have to turn this information over to the government as well. So you are going to have to look for information on kind of how the DOL is expecting for employers to do that. All right. Another thing, and these are like multiple things that I just thought I'd throw in to kind of just talk about, you know, some changes to employers that are really things that are designed to kind of make their compliance obligations a little bit easier, you know. And so this is a number of, just like I said, different things. The first one is the elimination of notices and disclosures to unenrolled but eligible employees. On the retirement side, and this is kind of different than on the health and welfare side, on the retirement side, a participant is someone Sorry, I had some change to my audio. On the retirement side, a participant is not just someone who is enrolled on the plan, but it's also someone who's eligible but may not be enrolled. Whereas on the health and welfare side, generally for Form 5500 purposes, then eligible employees are those who, or just employees who are participants, are those who are enrolled and not just eligible, okay? So on the retirement side, because they had this dynamic that people who are eligible but not enrolled are still considered participants, then they were having to receive all these notices that the plan might have to put out by law, right? That can suck because a lot of those people are not going to even read those. They're not enrolled in the plan. They're not interested, right? And so this comes out and eliminates a lot of the requirements to provide those notices and disclosures, with one major exception being that those people still have to receive a summary plan description when they become eligible. And so that's one change that I think that some employers are going to welcome by not having to send out all of these required notices and disclosures to a bunch of people who are not on the plan and frankly not interested. Another change that we saw was the idea of increased cash out threshold of $7,000. So we've talked about the requirement to distribute funds out to terminated participants. And it used to be that if people had up to $5,000, you could automatically distribute them out. And the change that we get under the Secure Act is that now you can automatically distribute them up to $7,000, right? And so those people who have between $5,000 and $7,000 are now in the group of people who you can automatically distribute, which I think will be welcome to some employers, especially if they have employees who were like, you know, $5,005 or just something that was very minimal above $5,000. So that's a change that'll be effective at the end of this year as well. We also saw a piece that said that participants can certify that hardship requirements are met. And so they don't actually have to provide the employer with, let's say, documentation of their hardship. They can basically do the equivalent of an affidavit to say, yes, I am going through a hardship that meets the requirements that would allow me to have a withdrawal. Again, that just requires less on the employer to have to substantiate, frankly, which is somewhat helpful and reduces some of the burden on employers. And then lastly, another one that I'll mention is that electronic benefit statements can be sent for 3/4 of the year. And so that means that only 1/4 of the year has to be sent in paper. That is also a change, but allows for employers to not have to mail out as many statements. Now, mind you, on the defined contribution side, you know, fund custodians are basically sending these statements out, so this may not affect employers that much. But if you do have employers who do take on the obligation to send these statements, then that might be a welcome change that they can now do 3 out of 4 of them electronically. Keep in mind, this is just a little bit more wiggle room for employers to not have to kind of meet every little requirement that they have been meeting for their retirement plans for decades at this point. All right, so some takeaways, okay? That was a whole lot of retirement stuff. It was a hodgepodge, but the takeaways are really that, again, the Secure Act 2.0, similarly to Secure Act 1.0, it's really just looking to provide more options that would allow an employer to provide a retirement plan solution to their employees. Keep in mind, employers are going to have to make sure the changes are made to the plan document SPD. Again, fund custodians or record keepers are going to help with that. There might also be some changes to employee forms and communications that will come as a result of these changes. Likewise, some procedures and operations are going to be changed, and HR staff should be aware of the changes that are going to be made, especially as employees would come and potentially start asking about them. One additional takeaway that I did not add here from the standpoint of employers is that a lot of you multi-state employers might even be in states now that are starting to require that employers either offer, let's say, a retirement plan solution or enroll their people into the state solution. Okay, and so because we're seeing that from, at this point, I think 15, 16 states are looking at or already require something along those lines. I think that it really just goes to the idea that society, the industry, the governments at large all realize that access to a retirement plan is really important. Okay, and so I think this is going to be something that is going to continue to be under a microscope and that we're going to be continuing to focus on. As far as employees, really you're going to have additional options, on lifetime income investments, additional options on kind of, how you take distributions and when, additional options for ways to save in retirement plans and things like that, in addition to additional tax credits and things like that as well, that are going to make it easier, hopefully, for us to save. And so that's kind of the big changes that we get from Secure 2.0. Roger, that was a whole lot, but we're going to switch gears and talk about a piece that did not come out of the CAA. It just came at the end of the year. So Roger, you want to talk about RxDC relief that we got?
Absolutely, I do. Thank you, Beth. And one advantage of going first and last is I can take a quick time to just clarify something that I said earlier at the beginning about the telehealth. I do want to clarify, HDHPs can, CAN, they can cover telehealth and do. The question is, can they do it beneath the deductible on that basis and still be an HDHP for HSA purposes? These extensions allow plans to do that if they want to, but otherwise it's not that this is only allowing them to cover telehealth for this time. It's just beneath the deductible. I think I misspoke on that and confused a couple of people. So hopefully that has been clarified. Speaking of confusing communications, let's talk about the RxDC relief, which essentially RxDC is short for prescription drug data collection, or as somebody thought, prescription drug reporting to Washington, D.C., which is also kind of accurate as well. But at any rate, the Consolidated Appropriations Act of 2021, 2 years ago, established this requirement, which essentially requires plans and insurers to send to the central locale their prescription drug usage and what they covered. There's even lists like top 50 prescriptions and so forth, and it's a data collection sort of thing. And originally, when this was passed, it was the first reporting deadline was for December 27th, 2021, which was 1 year to the day that it had been signed into law. And then the subsequent deadlines were going to be June 1st of each year after that. They're to be made through the Health Insurance Oversight System, or HIOS, or has various pronunciations, but essentially online. Now, it was pretty well known right when this was passed that this was going to take a little longer, people thought. So in August of 2021, the agencies deferred the enforcement of these first two deadlines pending further guidance. A couple of months later, in November 2021, they said, all right, these reporting deadlines for 2021 and 2020 are going to be December 27th, 2022, just a few weeks ago. So as we were wandering up toward the end of 2022, there were a few issues going on. People were getting delayed. They had to get the information, and they were just the typical kind of growing pains that happen when you establish this sort of thing. So right on the eve of Christmas Eve, December 23rd, 2022, the agency said, all right, we're going to do some enforcement relief. And what we're going to do is we're not going to have any enforcement actions against plans or insurers using good faith and reasonable interpretations of regulations and reporting instructions. And they also offered a grace period for submissions, essentially another month through the end of this month, January 31st. 2023, and that is also contingent upon good faith efforts. Very quickly, what does good faith mean? Good faith means that these plans and insurers, these reporting entities, are doing everything they can to comply with these regulations, despite some of the issues and hiccups along the way. Good faith does not mean, well, they don't have everything done, so we don't have to report at all. That's not good faith. That's bad faith. But good faith means they're going to, the agencies are going to work with folks. They understand there are a few, again, hiccups and issues, and work with folks to get all the stuff in, because at the end of the day, they want the data. So a couple other clarifications they offered as well on December 23rd was there was a little confusion. Could one reporting entity have multiple submissions? And on the other side, could there be reporting by multiple entities on behalf of the same plan or insurers? Yes, both of those things are okay. There's also some optional reporting available now for amounts that are not applied to deductibles or out-of-pocket maximums. And in some cases, very limited and very small reporting issues, people can do it through email as opposed to the system. And that's what was made available. So essentially, everybody's got an extra month to get their stuff in if they haven't, or amend things that they did. But at the end of the day, it looks like the agencies are giving everybody a chance to get the stuff together. And I think that's probably going to be pretty much going forward. Things are going to be pretty standard, at least they hope so, and it does look that way. With that, I'll give it back over to Beth.
Thank you. And I will say about the RxDC reporting, we've been getting a lot of questions and stuff from employers who may still be having a hard time, right? The system apparently has kind of been overwhelmed a few times. Hopefully you are working now to comply with that. And we'll have to see, if the government, does any kind of further relief, but it is definitely a situation where you want to make sure that you're at least attempting to do that and documenting any such attempts. Okay, hopefully, like I said, you will get to a successful submission, but if you are having a hard time, make sure to document everything as you take steps to attempt to comply. And we'll have to see what the government does in the future having to do with this particular requirement. Okay, all right, so looking ahead and just some takeaways. Mind you, we talked about some of this a little bit with the December Get Wise Wednesdays when we were talking about just all of 2022 and looking into the future. As has been pretty much the case for the last several years, again, this is that end of the year legislation or budget basically that we're getting where we're getting some new compliance obligations, okay? However, we are also going into a year where we have a Republican-controlled House, a Democratically controlled Senate and presidency, and so that means we're going to have some gridlock, right? And so this time next year, this presentation may not actually be about the end of the year omnibus if we don't get much that the two parties can agree on, right? Now, interestingly, there are some things they do agree on, right? So we might get some more mental health parity stuff. We might get some more movement on certain things that potentially did not make it into this bill. So like some legislation around dialysis, some legislation having to do with Medicare and potentially changing some of what is available through Medicare. We might see some more of that type of legislation that everyone can agree on. But because we're going into a year where, we don't have the same party controlling all three, we're not going to have as much action potentially as we did over the past couple years, right? Keep in mind, that we're still going to see the Biden administration go through and make regulations, but also I should have put a caveat there. We are also in a time where it's very highly litigious. So we're seeing pretty much somebody sue every single thing that any president does at this point, right? And so the courts are also going to probably take an outsized role or oversized role in kind of making decisions about some of the things that the Biden administration does attempt to accomplish. As always, though, it's important to continue to work with your service providers, specifically having to do with compliance. I talked a lot about the different provisions of the Secure Act and the things that are going to be put in place. And somebody even asked a question about whether or not a lot of that stuff was required. And it's not all required. Employers can choose to offer certain elements of the provisions that the Secure Act provides. And so you're just going to want to work with your service providers to make those decisions for your plans in an educated and prudent prudent way, right, for my fiduciaries. And then basically, as always, our team is here to assist and provide you with information on any developments that we find, okay? And so I've been looking at the Q&A. I don't see anything kind of outstanding to address like right now. With that, I think I'm going to turn it over to Amber, but I definitely wanted to say welcome to Roger on your first Get Wise Wednesday. I think it went really smoothly, except for my audio going out for like 10 seconds. But welcome to these.
Thank you, Beth. I appreciate it very much. It's fun to do.
For sure. So Amber, could you just close us on out?
Of course. Thank you, Beth and Roger, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you, everyone, for joining us, and have a great day.